taking this talk to the next stage, where I would like to invite Professor Rajendra Pratap Gupta to give a little introduction, although he doesn't need any introduction. He is a public policy expert, founder of Health Parliament and Digital Health Academy. Uh, and he has been associated with several foundations, organizations, and initiatives. He has been advising to Indian government, international governments, and many organizations, including the UN, the UNESCO, the World Bank, the WHO, etc. He has been awarded and nominated for. He has been awarded for several awards, as well as was nominated to World Economic Forum for Global Agenda Council. I now hand over to Professor Rajendra Prasad Gupta to give his talk. Sir, over to you.
Thank you so much, and really appreciate your inviting me to this forum, Manish. And I think it's a great moment for the country for this Jan Care, and the fact that we are going to look at 75 disruptors, I would call them, whom we nothing to worry, because at the end of it we have to still realize that despite all the technology, human intervention will be required. So let's carry on. And I am more excited to the fact that IKP and BIRAC are leading this. I had a good fortune to work with Dr. Shishendu Mukherjee and Dr. Dipanvita, who are, I think, among the top leaders in this domain, and over a decade. So that also gives me more excitement for the Jan Care reaching to the level that was envisioned. So the way I look at reimagining healthcare is very different. We all look at healthcare from the siloed perspective, like what can change. So I was thinking, okay, what do I share with the people who are looking at applying for this startup program? So if I were to just overly put to you, what is the future? How do we remanage in healthcare? So anything you can look at health or touch in health needs transformation. There's nothing that doesn't need a transformation. All of it needs transformation end to end. That's one. Second, COVID has bared the reality of the fractured health systems. It has also led India to be one of the largest producers of so-called PPE kits and other things that we needed. So it triggered in us an opportunity to show to the world that we can develop things that the world needs. So I think from my side, anything that you can imagine in healthcare needs to be transformed. I think yesterday I put out some stats about Indian healthcare on my Twitter and LinkedIn, so I'm not going to repeat that. But as a startup, I need to share certain things because I had also an opportunity to be on the other side of corporate world and as startups. So you need a value proposition. You need a business model if you're applying for this program, and most importantly, when we look at this particular program. So you need to have a value proposition, a business model that mostly you will be bootstrapped if you're applying. So for me, business intelligence comes before artificial intelligence. So make sure that you have that business intelligence. And I think there are a lot of programs that BIRAC runs, at least I know that. And I'm sure IKP too, which provides a lot of inputs. And I think they're on a weekly show as well. I'm sure someone is going to talk about that too. Whether you are funded or not, you can still leverage that opportunity and, learn about startups. So when you look at startups, when you look at healthcare as I'll say as a domain, there are two ways you can approach it. One, you can look at from a market standpoint. Other is you can look from a population standpoint. Both the numbers run in billions. So if you look at healthcare as a market, you can take anywhere Indian healthcare market between 250 billion to 372 billion, whichever number you believe, but it's a huge market. Essence is that. If you look from a population standpoint, of course, 1.39 billion people and almost 600 million medical conditions, in terms of the chronic comorbidities that we have. But yes, if you're a startup, you have to understand one thing. Indians are real value driven. They drive you crazy in terms of value. And I have one number to substantiate that part. We have 800 million to whom our government is actually providing free ration. So that should give you a sense of when you work on innovation, do not go overexcited on pricing. You have to be very realistic, and that's where innovation comes in. Now, from a patient and disease spread, there is no difference between rural and urban areas. I thought I would make my points as points, and you got to read between them and make business sense out of that. And each of these points have a business opportunity. So there is no difference today between rural and urban in terms of the prevalence. or whatever diseases or medical conditions you say. The challenge healthcare faces is we are asset heavy. We are really, on models which are unsustainable. So disruptors like you as startups will have to look at them from becoming aggregator or asset light or low frills, because like it or not, we have moved towards an insurance model. We have the world's largest insurance scheme and funded by the government. So certainly we will talk about outcome based healthcare. If not now, I think the health policy clearly outlines that, or what we are going to look at. I think all innovators who are looking at applying should read the 36-page health policy. It's a short one, but it outlines the agenda of the government, and that is what the government has been implementing through various programs. In terms of a business opportunity, healthcare today is reactive. From the care seeker's point of view, from care provider's point of view, you don't get what's needed, you don't get the appropriate care, and trust is fast eroding. And all of these are also opportunities if you are a startup. And also, healthcare is driven overly by doctors. And I say this, that we need doctors, we know that, but technology is a great leveler. And I think if you are a startup in digital domain, you would realize that before anyone else. And if you look at the caseload scenario, this is a very interesting opportunity that comes to all of us. 10 to 15% of the population suffers from mental health issues, and we have only 6,000 psychiatrists. Just amount the amount of load that people have. And most of the psychiatrists are in metros. Just think about the opportunity that you can plug as a gap. So we have a national mental telehealth program announced in the budget, but there'll be more opportunities coming the way. Look at cancer, we have 2.4 million cancer patients at any point in time, and we have only 500 medical oncologists. That's another big opportunity. We have 30 million heart patients. We have 4,000 cardiologists. We need 88,000. So again, you look at the gaps, and when people use two words together, digital divide, I think that is itself a business opportunity, because digital and divide should not go together. When there is digital, there should be no divide, and that is going to be, I think, addressed by entrepreneurs, which are going to be supported by BIRAC and IKP. Above all, what I see as a big challenge, being in healthcare and being in it, working at the government level ever in the past, despite all we have, we still have patients who come and say, I need to go to AIMS, I need to go to Tata Memorial, I need to go to Kidwai, I need to go to Nimhans or PGI. There should be solutions where we filter and serve these people in the places where they are seeking care, and they should not be referred to the so-called national level center. So I think there is a great opportunity out there. It is not that those tertiary care institutions need technology. The places and the people whom they serve, they should be served in the places they're coming from. That's one. So between August and October last year at Health Parliament, we ran series of master classes. We got world's top leaders. We posed toward the challenges we have, and we looked at what are the solutions. So three messages came out very succinctly, and they have a great business opportunities. First thing, for primary care, the focus that we have for this particular workshop or webinar. So primary care is moving beyond doctors. That's a fact. In fact, one of the tallest leaders in the world, who was involved in many reports, including with Eric Topol, made this point that intelligent EHRs could do a whole lot more than primary care doctors. That's one point. Secondary and tertiary care moves beyond the beds. So that's another major opportunity. How do you deliver care beyond the beds? And if you provide proper primary care, secondary and tertiary care gets addressed to a large extent at a very early entry level. And the third is management of chronic diseases moves beyond the pills. And why this is very important is you got to understand that the role of provider, payers, and regulators are going for a big change. And I'll give you two examples, and this will give you a sense of how fast healthcare has, I think, disrupted itself. So, software is prescribed like a drug in the United States and Germany, which was not the case. It is provided and reimbursed like a drug by insurers. And there's a very interesting thing. In 2018, WHO classified gaming as a disorder. In 2020, US FDA used gaming for treating a disorder, ADHD. So that's the disruption that's happening in healthcare. I think this is when India has still not upped the ante. I think when you all start using this Jan Care scheme and build up newer solutions, we will disrupt it more. So the future of healthcare, as I see, is has to be reimagined from your eyes as an entrepreneur, and not from people like me who carry a huge baggage. I've written an exhaustive book on digital health, which is like a 600 pager. It talks about a whole lot of things from all 31 specialties of what's going to get disrupted to the professions that are going to get disrupted. So I'm not going to deal much on that. I'm going to be really brief so that we can take more question and answers. So what I see as disruptions coming in, if you really look at primary care, is we need to be proactive, we need to be integrated, we need to be predictive, and we need to move towards precision medicine and aggregator models with point of care diagnostics. So in a sense, if you ask me what's reimagining healthcare, everything that you and I see, we got to get and disrupt it. And this program allows you to do that. This will fund you right from an idea to a pre-launch to a launch phase. So this, I think, is a fantastic opportunity. I, in fact, looking forward to learning the innovations that come through it. And thanks for giving me an opportunity to put my views across.